Can you tell us from your clinical expertise, Dr. Aysam, maybe how do these environmental factors manifest in patients in general? Maybe we can talk about nasal congestion, other symptoms, cough, cold, etc.
Yeah, actually, before I start, when Dr. Rawad is now talking about this, how far these particles, the pollen, for us as a working in the medical fields, pollen we divide it into three things.
Okay.
Infectious particles like viruses. Of course, viruses is not bacteria because virus is more transferred by the air droplets. And it's not vital. All of us know that virus is not vital until it enters the body. So whenever it has a chance to transfer in a longer distance, it means that chance to get more human being to get in and be vital is more, the chance to spread more. The second thing is the irritations, not the pollen, the allergens. So we have two kind of allergic affectants. Irritations means like chloride, like CO, whatever. And the pollens, which I mean that it's the protein. The allergen is a protein make immunity system reactive to as allergic symptoms. But the irritations, as for example, always I give my patient this example at the chloride gas. This may irritate anybody.
Correct.
But allergen like a grass, you may be sensitive to grass,
and
I may not.
somebody else who's not. Yes.
So we have three main things this climate affect, how these three main things affect the airway. Of course, we are seeing now more than 2 or 3 days, a lot of recurrent infection, a lot of resistant allergic symptoms, not easily controlled by medication. And the duration of the disease becomes not as we study in medical college, like 7 to 10 days. We see a lot of patients suffering more than 2 to 3 weeks, sometimes 4 weeks, and nothing to be done with these patients. Still, it's a virus, not complicated with it's a bacteria in a healthy patient.
But
that's
sometimes
why
we see maybe patients coughing a lot for a long period of time.
Exactly. It means that he's spreading the virus a lot.
Okay.
So coughing is the source of spreading the viruses. So with this changing in the duration of the disease, we have two more facts. I'm talking now about the virus exactly.
Yeah.
First of all, the duration that the patient may transfer the viruses to others. It's now longer, not more than more than 10 days.
Okay.
And when the disease is make this inflammation in the body, we have high percentage in unhealthy people or people who is working and they are in stress and the immune system is not very active. It will go to secondary bacterial infection.
Okay.
So we have more bacterial infection
than viral infection
because we have this long acting virus infection.
Okay.
That's one of the things that we are noticing in our field. And the only thing that I like to discuss with this podcast, that we need the people, we need the pharmacists, we need even the other physicians, GP, family medicine, to know what's happening with us, because always they are been asking from the patient, why I still have I'm taking medication, why I'm still sick. This is the very important and at the same time silly question we cannot answer. Why? Maybe today
because
we
of
can.
Climate change.
Yeah. Maybe we can highlight this today and find a little bit like a suggestion or kind of solution that may help the people.